Hi, my name is Dr. Gideon Kwok, and we're here with AI Wellness Education, and we have an amazing special guest, Dr. Rafael Gonzalez. Thank you for joining us.
Pleasure to be here. Honored to be here.
I know we are so excited to have you because you are one of the gurus in the regenerative space. Talk about stem cells, exosomes. This is where, as a physician, I'm already looking towards this as things that are going to, I don't say necessarily extend life, but give us the quality of life that we are all looking for. And I know our healthcare system is completely failing us right now. And so we are so happy to have you here to talk about what is in this industry of regenerative medicine and take us down the road of kind of what it's all about.
It's actually it more boils down to, if you look at our body, we are composed, of course, of cells. We live in a 3D matrix, and essentially it's finding a way to, number one, make changes within cells to maintain health, because we want to live longer, and more importantly, what you just pinpointed on, we want a better quality of life.
Yes.
I'd rather die tomorrow than suffer with a ton of pain, have a bunch of issues, and then live like that for a really long time. The system, exactly like you said, is somewhat flawed in the fact that it's more of a reactive versus a proactive approach with everything. And cells are the future of medicine. It's something that's completely organic. Everybody is into organic now because it's a healthy living.
Right.
And it's something from you. It's something that's composed of you, and it's something can help make changes,
Right.
On a regular basis.
And these cells are ultimately, from what my research has been, you have the most when you're a baby, and you use majority of up to grow up to who you are as an adult, and then you have a little bit remaining for the rest of the life.
Yep.
And so the goals are to improve the access for your body to something that is going to create some
Yeah.
longevity in that aspect.
Yeah.
Is that kind of what we're doing in the regenerative space at this current?
100%. It's essentially, for instance, the stem cell sector. Everybody's heard the term stem cells.
Yep.
All of it's out there. There's many different ones. I love that you brought up the point of, the younger ones, the better ones, because when we were younger, we healed like this.
Oh my God.
It's just crazy. It's so much better than when you're older. And essentially, our focus is more on the immune system and maintaining that immune health, because every single disease in the body has an immune component to it. And it's important to be able to do that, because we can heal within, feel fantastic within, when we maintain immune health. As we get older, we become into what's called the chronic inflammatory state.
Yes.
That's when you start having heart disease, neurodegenerative diseases, all these different issues. And stem cells, what is known out there right now, and even the studies we've done, is that if it's done correctly, you can regulate the immune system, which is what you want. You can sort of get that chronic inflammatory state and level it down and bring the anti-inflammatory state higher, where the system is regulated and it works well.
And the body heals itself.
And the body heals itself.
You just have to give it the right environment for it to heal itself. If it's constantly fighting fires, in my mind, that's what I'm saying.
Yes.
If it's constantly fighting fires, you have no time to actually heal and recuperate and regenerate.
Yep.
And what is it that you would love the public to understand about stem cells, exosomes, in a general sense, kind of, because there's so much information out there. And the whole goal of AI Wellness, the educational platform, is to gather this information into more palatable content so people can understand what it's all about, what the fallacies of, what
Yes.
people talk badly about it. And, there's so much bad information and there's so much good information. People don't know how to swim through and decipher all of that.
Yeah, all of that. So essentially, stem cells are in your body everywhere. You see them, you talk about bone marrow, you talk about fat, and you talk about what's called perinatal tissue, which is the umbilical cord, the placenta, the amnion. Right. You can get them for all these different places. Of course, if you think about it in context of the younger, the better, because the younger you are, the more cells there are, more stem cells there are. Throughout time, you get this thing called stem cell exhaustion. Your cells don't multiply as much, because every single cell in your body has a finite amount of divisions. And as they divide out through life, you get older.
Yep.
Well, I'm a scientist, even in petri dishes, you can actually see these. When they're really young, you'll see these really small cells, really nice, bright looking, beautiful looking cells. And then you grow them up, and then you look at their biological age, they're 40, 50, 60. They look bigger, fatter. It's essentially what's actually internalized in our body, what's happening to us. But you know, you're doing this on a petri dish. It's pretty crazy, and you can actually see it.
Wow.
And ultimately, the younger the cell from the starting is number one, is important. Number two is the purity of a stem cell, because too many people are talking about, you know, we take out bone marrow from you. They don't do anything of, for instance, growing up cells. Normally, when you look at what's called the mesenchymal stem cell, a particular type of stem cell, you need to take it, isolate it, and grow it up,
Right.
expand it. And of
Exactly.
course, when you grow anything, you mature it.
Right.
You're maturing it, make it older. For instance, the cells that we use are about 15 years of biological age,
Okay.
because we mature them up. We have them actually in clinical studies right now in the United States. But it's ultimately looking at that, number one, and then number two is the exosomes that are produced from the cells, so the stem cell in particular.
Right.
And a lot of people are like, well, what are these exosomes? This is like the new hottest thing.
Right.
And it's essentially a nanoparticle. It's a bioactive nanoparticle. Every single cell in the body has to communicate with the other.
Right.
And the simple example of such is actually looking at hormones. The pituitary can signal, can release, and then go all the way down to the testes in the context of man, produce testosterone.
Right.
And it's the only way that it's actually done is this bioactive molecule is protected, similarly to cell, by a lipid bilayer.
Right.
So every single cell, not only a stem cell, but every single cell in the body does this form of communication. In the context of a stem cell, depending on how you grew it, meaning the feeding that you gave it and what you did to it, and also the use of it, how you grew it up, depends on what's released,
Interesting.
what it does, the healing cues, the regenerative cues of it, because these require signal from one cell to another cell and make another cell do an action.
Okay, so essentially, in my analogy for people out there, kind of, it's like a CEO that gives out messages, and all the people do their job
Correct.
as opposed to in a fine-tuned machine, and then you send these people off to a college, and they have their specific things that they end up doing with it. So the way you grow them out is probably the most important part, because I
Yeah.
think that's where people don't understand. Because as a physician looking into it, there's so many different companies that are popping up
Yeah.
right now, and it's a scary thing because you are injecting these things into a person's body, and the fear factor of what's going to happen to me, the fear factor of because it's from somebody else.
Yep.
Those are the questions that we always get with regards to that, and so understanding that process of how you're making it, what makes it safe, what makes it viable for the longevity aspect of medicine is important.
Yeah, I mean, ultimately, you look at number one is safety, of course, exactly what you just talked about, and how cells were grown, what testing was done. I mean, it's a crazy amount of testing we have to do to validate, the product that we have in clinical studies, because it's essentially considered a drug.
Right.
You look at that, number one, and then number two, in the stem cell sector, people always talk about regenerating organs, replacing tissue. That is actually not what's transpiring. We now know. The mechanism of action is, the cells, for instance, if you do an IV, then the cells will migrate towards the lung. They'll stay in the lung, and then they'll try to understand what is going on in your body. And then based on that, they have to figure out a way to survive, because the cells actually end up dying in your body and your immune system picks them up. So they end up trying to say, what do I need to heal? What is lacking that I can live? And they basically feed off their neighbors by releasing exosomes. The exosomes then go to the cells in your body, what's called your endogenous cells, and then they force those cells to make a change, which in the context of that, your body's the one that's actually regenerating, not the cells that were put in. The cells are releasing these cues, causing your own cells to make that change, that functional change that's needed.
Wow. So then this dives into a whole world of things that support it as you're doing your treatments
Yeah.
and things like that. And we'll get into that more into our next episode. But I'm
100%.
excited to really dive into this topic for a lot of the people out there because it's fascinating, and I think it's where medicine is going to be, because that is the only way that we are actually going to allow our bodies to repair themselves instead of traditional medicine. Family doc here, you give a blood pressure medication, you know you're going to be on that for the rest of your life.
Life.
And so
Yeah.
this is a way to actually start that repair process for the body to actually get them off of those medications, to get them to live healthier lives.
Yeah, agreed. I mean, besides that, so I discuss working on the inside of the body. You're the pro at working on the outside.
We
and,
do.
and that's actually my interest now, because I'm not a pro in that, and I do understand cells, but you're the one that knows the aspect of how do you make somebody look good, because you want to feel good inside, you want to look good outside.
And that's the balance, and that's, for me, that's where I've been jumping back into the more of the healthcare side. I've been doing the aesthetic side for a while, and so yeah, the exosomes are actually starting to really, really make a move in our industry, because we are damaging, we're forcing the body to do something, and if we can put in mechanisms or cells, not necessarily cells, the messages to actually repair, de-inflame, you're actually causing the body to actually be able to repair in a faster way, in a more healthier way, in a more organized way, that really has less sequelae, less adverse events. And so I think where the beauty and from the inside and the outside is going to match and explode.
I agree. It's going to be a combined field, essentially.
For sure. Well, thank you so much.
Thank you very much,
We
Dr.
will,
Kwok. Pleasure.
We will bring him back and have more talks with Dr. Rafael Gonzalez.
Awesome. A pleasure. Thank you.